What's going on, everyone? I'm just a typical, average American here today to react to some graphs and data that show how healthcare in Canada is better than healthcare here in the United States. So, here in the US, I actually think that the care that you get at the hospital or from your doctor is actually very good. But our healthcare system, our healthcare insurance system, is absolutely ridiculous and bad and very confusing as well, and prevents a lot of Americans from getting the care that they need. And on top of that, I think a lot of us Americans are very unhealthy in general, and that we just have a very bad attitude towards being healthy and doing things that are good for us. So today, I really want to take a look at these graphs and learn about the ways in which Canada does a better job at healthcare than the United States. So let's take a look at this, starting with this first one is talking about life expectancy at birth. So this is just the average life expectancy of a Canadian versus an American. So on the left, in Canada, you can expect on average to live to 81.7, which is very good. And in America, it's 78.4. And to be honest, this actually doesn't really surprise me that much. I've heard about this before, that Americans have a lower health span than a lot of other countries. And I think, honestly, if you just think about it, it's probably because in Canada, nobody is really hesitating to go in to get medical care because there's no cost associated with it. There's no hesitation like here in America. You hesitate to call the ambulance because that could cost like $1,000 or something. That could, for a lot of people, that they don't have an emergency fund of like $1,000. That's a lot of money, let alone going in for like a surgery or something big. If you don't have the correct medical insurance in America, you could absolutely ruin your life, like with some of the costs associated with. But even with insurance, like giving birth, like me and my wife experienced not too long ago, like without insurance, that would have been, because you can look at the medical bill that you get. That would be like $50,000 or something. Seriously. And then after the insurance comes in and takes care of the majority, you're left with like, God, like still like $3,000 or $4,000 for like giving birth. It's pretty crazy in the United States. So yeah, and I've gone to the emergency room for like, it turned out to be a kidney stone. And they had to give me morphine and do scans, and that was over $1,000. Oh my God. Yeah. Yeah. And that's not even like the worst that some Americans go through. So I'm not shocked that Canadians live longer because you guys, pay for your healthcare through your tax system, which is amazing. That sounds so smart and so, man, what a relief. Like, you don't understand how much stress that would relieve for a lot of Americans who are so stressed about covering medical bills. The bill, you go in for medical care and you get that bill in the mail. You know it's coming like a week later or something. Yeah. It's funny because with the American healthcare, like they can be slow on a lot of procedures, or if you're in the hospital, it can sometimes be kind of a drag waiting for like the doctor to finally show up and get to you and get the scans scheduled. But the bill is always on time. They never forget that. That one's always on time. That's always very prompt. And I would imagine Canadians just have a better, just are healthier in general with your habits and your lifestyle habits and your food. Like here in America, I know that the food here is just worse for you. It's got more of the weird chemicals and preservatives and food dyes and weird stuff, processed stuff. So our food is anyway. You could go on, but this is not shocking that Americans don't live as long as Canadians. The next slide says infant mortality, deaths less than 1 year. This is why I am not a scientist, a professional scientist. I can barely even read this. Deaths less than 1 year per 1,000 births? I think it's saying if you are under 1 year old, an infant, how often infants die. Oh my God. Fewer babies die in Canada in their first year of life than in the United States. Really? So in Canada, per 1,000 infants, 4.4 on average will die. In America, it's 5.6. Not a huge discrepancy, but if you're doing like percentages, like 5.6 is like compared to 4.4, is that like 20% worse? That's significant, even though we're talking about small numbers. Like I think it's good that such a small number of infants are passing away per 1,000. It's good that these are both small numbers, but in America, it's still, 5.6 is still 20% more often than 4.4 or something like that. What this shows, fewer babies die in Canada in the first year of life. Why is this? Oh yeah, Canada's leading by 27.5%, actually. This is an indicator of Canada's better maternal and newborn care, prenatal access, and socioeconomic conditions. Whoa, because man, a lot of the stuff I'm talking about with healthcare coverage, I usually think about adults, but man, that's really sad to think that in America, like there are things we could improve to have less babies dying, that these children that are less than 1 year old. That's really horrible. We need to like look into this and try to get our number down towards Canada's number there. Wow. Oh my God. I didn't know that. Preventable mortality per 100,000. These are deaths that are avoidable through public health measures. Avoidable death. What is technically an avoidable death? That's a death that if you had treatment earlier, if they had caught your illness or given you treatment, better treatment or earlier, the death would have been prevented. Something like that. In Canada, the preventable deaths are 113 per 100,000. In America, it's almost double. 238. Almost twice as many Americans are dying that don't need to be. I mean, it's funny because this whole slide is about people who had preventable deaths. So it's sad that in Canada there's 113 people for every 100,000 that will die that didn't need to die. That's sad. But what is sadder is that in America it's twice as worse. Jeez. Preventable deaths. That's a sad statistic. America is 100% worse. Yeah, about twice as worse. Lower preventable deaths suggests stronger public health and prevention. Sure. Again, there's so many things, so many problems that stem from a system that we have in America, which really punishes you for going in to get treatment. Like, seriously, if you break your leg, or a better example would be if you have like a lump on your neck and you're like, that's nothing, I don't think that's anything, that it's probably just a swollen lymph node, I don't know, whatever, it'll go away. That's the attitude a lot of Americans have because you don't want to go to the doctor. Because even On a lot of healthcare insurance plans, even going to your doctor or specialist is going to cost like $50 or $100, which is really annoying. Um, and makes you think twice about going to get medical care, which it's so bad. The more I think about it, it's crazy this isn't like discussed a bit more in America. The hesitation of going in to get care associated with, being afraid of the cost. Even with healthcare insurance coverage, mind you. um, wow. So Canada is better at preventing these preventable deaths. Sad statistic. Treatable mortality, deaths that are avoidable with timely and effective medical care. This sounds like the same exact thing. Isn't this the exact same thing as preventable mortality? Deaths that are avoidable with public health measures? Deaths that are avoidable with proper care? There's some kind of difference between these two that I'm not really understanding totally, but they're essentially saying the same thing, I think. Avoidable hospital admissions. What? Lower potentially avoidable admissions in Canada. Avoidable hospital admissions. Diabetes, asthma. What is this? Huh? Fewer avoidable admissions imply stronger primary care and disease? What is a avoidable admission? Diabetes, COPD, asthma. These are are these conditions that are avoidable? Like, there's a type of diabetes that you can avoid getting with proper health and eating and nutrition. Is asthma avoidable? I don't. Avoidable admissions? I gotta try to look this up. Hold on, I gotta understand this. Okay, an avoidable hospital admission refers to a case where a person ends up in the hospital for a condition that could have been prevented or treated effectively outside the hospital through better outpatient care, intervention, or self management. Okay, so this is basically what I think this is what I thought initially. So, what does this say exactly? I think it's essentially telling me that in Canada, you guys have maybe just better health awareness or treatment awareness, just a better attitude and more knowledge and awareness towards being healthy and these conditions that are preventable or avoidable. In Canada, you have 388 per 100,000. In America, it's again almost double, 725 per 100,000. That's an interesting stat. I think this is really just proving that Americans let bad health conditions just happen to us that are avoidable if you're just more aware, more knowledgeable, or more health conscious. I think that's what that's saying. That's a very interesting one, actually. Very interesting. Okay, this is about population covered for a core set of services. Oh no! Oh, I understand what this is talking about. How much of the population has healthcare coverage, which in Canada is 100% of the population, sure enough. In the United States, it's 91%. And what we're really talking about in the United States is healthcare insurance coverage, which is a little different in Canada. If you're Canadian and you're paying into the taxpayer services and you're paying your taxes, you get unlimited healthcare coverage. Is that about right? That's my understanding, which is amazing. I think a lot of Americans would really like that, actually. Especially the 9% of Americans who don't have any healthcare coverage. Only 91% of Americans have it, and it's just partial coverage at the end of the day. It's just insurance, like for when something bad happens, you got your healthcare insurance information, and they say, okay, let's figure out if what your deductible is, or if there's a copay that you need to put down before we let you see the doctor, or I'm not sure if your insurance is accepted here. We're going to have to check if you're in our network, and all of this super annoying stuff. And I'm not sure if that procedure, your insurance is accepted here, but that procedure isn't accepted here in that specific one. It just goes on and on and on. And then at the end of the day, the insurance is only covering like 90 or 95% of the cost. But if the cost is $50,000, you could be left with like a $5,000 or so dollar bill, which is not great. I guess that's better than 50,000. It's better than your life being ruined. But $5,000 for it's ridiculous, to be honest. So, and then for the Americans, the 9% that don't have the insurance, you just don't go in. Do not go in unless you are dying. That's what I would say, because I don't even know how you can use our healthcare system without having healthcare insurance. For a lot of Americans, we get our healthcare insurance coverage and our healthcare insurance plans through our job. It is tied to your job. That's a big thing when getting a job in America. You ask them, so what's your healthcare insurance package look like? Do you have that? Does it cover my family? That is a huge, huge thing, a benefit that you have to really, really pay attention to when getting a job in America. And it's a big stress if you're fired, if you lose your job, you lose your healthcare insurance. It's pretty scary stuff. Adults with cost-related access problems. Cost barriers are much more common in the United States. So there is a cost barrier in Canada? Because that's interesting to me. I didn't know that. I thought it was all 100% covered. For 24% of adults in Canada, there is a cost barrier. What is the barrier? What costs something? Or am I not understanding this? In America, only 46% of adults have cost barriers. I think that's saying the amount of Americans with healthcare insurance that have trouble paying either their healthcare premium. You have to pay for your healthcare every month. You're charged every month. Like for a single person, like $300 to $400. Even through your employer, you oftentimes have to contribute some of your income for even if your employer is supposed to give you insurance. But anyway, for a lot of people, you got to pay every month for your insurance plan to keep going. And so maybe 46% of American adults struggle with that. And then on top of that, any of the bill that isn't covered by the insurance, you have to pay, like the thousands of dollars after an operation or whatever. Maybe that's the amount of adults that struggle with that, but I don't understand what Canadians are having trouble paying for. Fewer cost barriers mean people don't delay or skip. What are Canadians? What is the cost barrier to healthcare for a Canadian? That's what I don't understand. Brand and generic drug prices. Overall manufacturer gross prices are lower in Canada. So your drugs, prescription drugs, in Canada, this is an index. This is tough we're not talking about a dollar amount. So it basically says Canada is leading by 127%. Lower drug prices reduces the financial strain. Is that basically saying Canadians pay under half as much as Americans pay for prescription drugs? I think this is what the chart is saying. American drug prices are like over double Canadian drug prices. Prescription drugs, stuff that people really, really need, which is, again, not good. It does feel like the entire American healthcare system, it really just feels like a business when you're here and living it. Like they're just trying to make money off your misfortune and your illness and your injuries, literally making money off of it. which is a very scary thing. Healthcare being a business. In America, like, you don't have to buy a loaf of bread or new shoes or, you don't have to. Your survival doesn't depend upon it. You need healthcare. You have to pay it. So the idea that a business is selling something that you have no choice but to buy and they control the price, that's very scary. That's disturbing. Health spending per person. Oh, okay. In the US, an American spends twice as much per person while achieving poorer outcomes. Um, PPP? What does that mean? 600, 6,300 versus 12,000 units in USD. Oh, is this actually in US dollars? Canada is doing about twice as better again, 198% better. So we're talking about, this is a bit confusing because again, I'm just asking what are we measuring here for Canadians' health spending? Is this literally how much of your tax money is going towards healthcare? Or are there certain healthcare services that Canadians have to pay for? Maybe that I don't know about. And I know the things Americans are spending on, like the insurance premium every month, the copays, or the money. Sometimes when you go to the doctor, you got to pay a little bit. Deductibles, which is like the amount of money you need to pay every year before the healthcare insurance starts helping you. And then when the healthcare insurance helps you, there's a percentage that they don't cover that you have to pay for. So there's a lot of expenses I know Americans have to pay for. Out-of-pocket health spending per person. Again, about twice as worse in the United States. These are direct health costs. I'd be interested to know like what exactly these out-of-pocket costs are for Canadians. Because I thought it was basically all covered by your taxes in Canada, but there's clearly a few things that are not, that I'm not aware of, which is interesting. But anyway, this whole thing was very interesting. This is a really big topic of discussion, and it should be a bigger topic of discussion in America, especially if more Americans were aware of how much better things were in Canada with a lot of these stats and data and a lot of things that we could be implementing here in America or trying or even talking about that we don't even know about or care, which is really sad because it's our life, it's our health. It's pretty important, but I'm glad to have taken a look at this. This was really interesting. Anyway, if you enjoyed this, feel free to give this video a like or leave a comment with your thoughts on this healthcare in Canada versus America, and especially if you're Canadian and you understand any of the Canadian side of this better than me, that'd be great. And if you're interested in more videos like this, me reacting to Canada and seeing and learning about Canadian things I've never seen before, feel free to subscribe for more. And until then, thanks for watching and see you next time.